cancer in 1998 and had the first private positron emission tomography center in the state of Tennessee, which I was proud of. And that's launched me on my journey, this cancer journey, which to me, the cancer patient is a very special patient. And to me, all the cancers are different in their own way, and they all affect the family, and they all affect the word is a bad word, cancer word. Some of my colleagues in the breast world call it the beast. We haven't quite given it a name yet in the prostate world. What we've learned in the prostate world, which is so important about MRI, and the latest studies in MRI, we now have 4 level 1A evidence studies in the world showing that we can reduce the number of unnecessary biopsies, and we can reduce the number of cancers that are not going to kill you. We don't want to discover a cancer with the word cancer, but it doesn't really play by the rules of cancer. At least science so far has shown that some of these prostate cancers you will die with and not of, as Dr. Behrens has pointed out. And to me, this is one of the most important things about prostate MRI, is defining the grade of tumor or the seriousness of the tumor.
And I think it's also, that's my experience, that the patient, when he is entering your center or my center before the MRI, he's uncertain. And he wants to know where's my cancer? My PSA is elevated, I may have cancer, 1 out of 3. Perhaps the chance is even higher. And he wants to know where the enemy is. And Joe's going to show the enemy. The enemy can't hide for an MRI. Joe exactly shows you how aggressive the enemy is, so should you fight the enemy? And where the enemy is, so where should you fight the enemy? And you will be able to use the least therapeutic things. That means removal of the prostate not always is the right choice. And there are new techniques that zoom into local removal, local ablation of the tumor. That's emerging. So we are entering an entire new world, and that's what we call personalized medicine. And again, when the patient leaves Joe's center, he exactly knows where the enemy is.